Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Yeah, it's good to. It's funny you say welcome back, and nowadays it's almost always from actual travel, not just from not being with you on the podcast. So yeah, back from travel again, back in Rochester for the week, and it's beautiful weather. So I'm glad I'm here to experience it.
Yeah, it really is gorgeous weather, although it is sometimes nice to get out and about and see other places. And you've been traveling to a couple of big conferences in the healthcare industry. Do you want to tell us a little bit about that?
Yeah, so that was my last week. It was I had really the privilege to give one of the semi keynote panels at the Becker's Healthcare Conference, which is held in Chicago every year. This year, the Executive War College, which is another great meeting that's been put on by Robert Michel and the Dark Report for 30 years.
Wow.
He announced just at this meeting that it was a 30-year celebration that he's actually has sold the Dark Report to I think it's XLab, a lab media company, but the meeting will continue. So I was there one place Monday, the other Tuesday, but all to your point, really focused on toward the healthcare. Becker's just is more broadly the healthcare industry, and then Executive War College is more focused on the labs.
Now, you've been speaking a lot about healthcare industry, and you, I believe, said you chaired some sessions. Do you want to tell us a little bit about what are you seeing? What are the big topics?
Yeah, no, well, certainly on both sides. I mean, there's a lot of there continues to be a lot of interest and concern in kind of the financial sustainability of healthcare and how do what's the role of the lab in helping healthcare systems, grow, be sustained and grow. In fact, the at Becker's, I was the only laboratorian on the panel. The others were
Wow.
healthcare system leaders and CFOs talking about, building a strong balance sheet as part of your, with your assets and cash flow and all that as your financial sustainability. I think that as a big part of your financial sustainability, I believe that I got invited to that because of the work that we've done with Becker's, not just me, but as Mayo Clinic, to kind of speak to the importance of the lab in that in the financial, not just the care delivery to the patients that we serve, but also to the actual financial sustainability of the hospital. And so another thing that's gaining traction now is a study that we did actually with an independent agency or independent firm collecting data to really quantify that impact. And I'll be actually speaking in a webinar on that with Becker's, some in the coming days as well. So.
Yeah, well, I was very interested in that when I heard about that. Well, first of all, as laboratorians, we should be at the table with healthcare executives talking about sustainability of healthcare because of the big role that the laboratory plays. But then I was also very pleased to see that you did create a white paper based on your data that you've accumulated with this special study. And it looks like it's really focused on maximizing your health system's financial and performance from the laboratory standpoint, why the laboratory is so important.
Yeah, no, thanks. And it's catching a lot of interest. As I mentioned, I think the webinar has already got several hundred people that have signed up, which is pretty interesting, to say the least. And it's really, I think, because the messaging that we're trying to help with the labs is to get the message out there. I think from the Carrie, you and I have talked a lot about how it's very difficult for any individual physician or provider sometimes to see holistically how much lab medicine contributes to patient care because they're interacting more around their specific patient and their specific tests, as opposed to thinking about the totality of the lab. I think the same is also true from a financial perspective, right? That it's easy for a hospital lab to look at what they're spending to maintain the lab. It might be more difficult for them to quantify what the return on that investment is, right? And investing in your laboratory. And so we were able to again, go and pull independent data and really look at what are those contributions that they make. And we actually found 5 key areas of financial performance, which are directly linked to ownership and retaining ownership and growing your clinical laboratory, making that investment.
Yeah, let's go through those one at a time, if you don't mind, Bill. I think it would be really interesting to talk about how important the contribution to the laboratory is and why it's so important to have health systems maintain their laboratories and ownership in their lab. So
Yeah,
the first, yeah, so the
go
first
for it.
one I have is growth in revenue.
That's right. So, I mean, again, it's funny because you and I both grew up in the nonprofit environment at Mayo Clinic, which is
Hmm.
great. It's wonderful. All right. But then, so it was really, as I was first thinking about having a leadership role in our own department, back when I was the hematopathology division chair, first time I really thought about, well, finances are really like the vitals, right? They're like the vital signs of the performance and your ability to deliver good care. So they're important for everyone. So that's number one. And then if you look at that as a vital sign, one of the most telling things right off the bat is that keeping control of your lab, or the health systems that retain their labs actually grow a 1.4% compound annual growth in revenues higher than those that do not. So,
Hmm.
and it sounds like maybe not a huge percentage, but when you look at that's of the total performance of a healthcare system. So we're talking tens to hundreds of millions of dollars. And because it's a compounded annual growth rate, because every year you have the lab and every year investing in the lab, it's bringing those investments back to you. So I mean, it's quite remarkable. There's a bar graph in the white paper that really shows the separation, and it just shows that the long-term impact of retaining or not retaining your lab. So, and that's part of why we're targeting this also to not just laboratorians, but to really empower laboratorians to have those conversations with other leaders in their organizations that they have the privilege to serve in, because again, someone that's looking at the finances, particularly right now when there's so much turmoil, might not have that long-term view. But for the long term, if you just take that as like the temperature, if you will, of the vital
Hmm.
signs, it just shows that if you want to stay afebrile from a health system perspective, you should
Hmm.
retain your laboratory.
Retain your laboratory. And when you say long term, it's not like we're talking 20 years from now, too. This is just 5 years that you looked at this, and the net patient revenue delta over that 5 year period was really significant, millions up to $1 billion in these healthcare systems that have maintained their lab ownership.
Yeah, that's right. And it really goes back to the topic that I was speaking to at Becker's, and that is that revenue allows your health system to have more cash on hand
Hmm.
to really weather the storm here or make the investments that are needed. I mean, look, 10 years ago, 5 years ago, we weren't planning. I don't think there was any health system leader that was planning about, well, how am I going to adapt my systems for cybersecurity or for the implementation of AI in our clinical workflows? So, I mean, these are things that all require capital, and the lab is a really important source for that, to your point. So, and
Yeah.
that's in the near term and the long term.
Yeah. Well, let's go on to number two, which is right along these lines, growth in lab charges.
Yeah, that's right. Yeah, I mean, I think it stands to reason. But if you retain your outpatient laboratory, your outreach lab, which is really what tends to be some others in the industry tend to want to come in and acquire from you and
Hmm.
promise you to run it better. What you'll see is actually what we saw, the data showed us, I should say, is that having that outreach lab actually increased your charges for laboratory services across the spectrum, right? And that there was a significant difference between having your lab and not having your control of your outreach laboratory and your ability to grow the lab charges and lab revenue. And again, revenue is a sign, right? It's not just even about the financial security, but that means you're interacting with and impacting more patients. That means that the data that you've created is now still within your health system and can be part of integrated care delivery or other things that you might want to do with data in this day and age, right? So it does. There's certainly a direct correlation that's really not surprising, but it's again several percentage points differences, and
Hmm.
so it really does sort of it really that not having that ability to reach out into your community from your hospital laboratory really has pretty significant effects on your ability to actually serve the community and grow with the community, right?
And I really like what you just said, serve the community, because your healthcare system, you are part of the community as a healthcare organization. You're providing care for the people that live in that community. So if you're growing that and you're able to serve more people by keeping your laboratory, then that's a really important consideration. People don't have to go to a draw site and have a specimen sent off to someone who's not necessarily understanding the dynamics of that particular community.
Yeah, and let's face it too. I totally agree. And one of the things that our shared experiences in the past was COVID, right? And I think that
Mm-hmm.
was for both of us. It was really gratifying to be able to actually step up and serve the communities with it, which Mayo is here in the Upper Midwest. Because a lot of times people are like, well, is Mayo Clinic really about Olmsted County and about southeastern Minnesota and southwestern Wisconsin, or is it about something, bringing people from the outside? It was great to be part of that community, build that, and really, again, healthcare is a community asset. It's something that brings us together. We want people seeking the healthcare systems for advice. I mean, the data now on people that, defer care because of financial reasons, or that go to a lot of different sources for information, the pharmacy and something else. I think just community presence is huge.
Yeah, I agree. And that actually brings us nicely to the third point in your white paper, which is growing not just in laboratory, but ancillary services too to serve the community.
Yeah, that is actually was one of the more surprising things out of the study that for me, I mean, it's surprising that of the magnitude again, where there's a really significant difference between if you have your laboratory, you're much more likely to do radiologic studies on that individual, and you're much more likely to do EKG on those individual, and maybe physiotherapy. But even just staying within diagnostics, it really to me signified that, you know, when we think about diagnostics clinically, we think about them holistically and how they serve patients. And so to take a big part of lab out of the equation, I guess it stands to reason that other services for them would start to, out leak is, I think that they go someplace else essentially.
Right.
Again, that's not good for patients, to your point. That means now the
Yeah.
information, getting a radiology exam. I have had family members that have gone to some of the stand-up shops for radiology, and then they don't get the result for 2 weeks, and then they don't know
Hmm.
what it means for them. And it's not that those things are bad, but I mean, it's better for patients to get something created, that diagnostic information created in the environment in which you're being served, I believe. And
Yeah.
also, again, from a financial perspective, I mean, that's when you start to see the carry-on effects. And I think that goes back to that first point. That's why you see the financial performance as a whole start to dip, because
Mhm.
the laboratories, as you said, and I've said, is a really foundational part of the healthcare delivery. And so start taking out pieces, and you're going to have unintended consequences.
Well, and I've said this numerous times, but I think of the laboratory as really the foundation for medical care. And so all of those other things we just talked about, other services, uh, electrocardiology, physical therapy, radiology, infusion therapy, the laboratory plays a role in all of those. Often laboratories values laboratory tests are ordered before someone does a test. If that's all being done in the same healthcare system, then you're providing this seamless inpatient, outpatient care coordination, and the hospital and the healthcare system maintains control of all of it.
That's right. That's exactly right.
Yeah. Well, speaking of hospital inpatient and outpatient, the fourth item that was in your white paper is a shorter length of stay. And I have to say that surprised me a little bit too.
Yeah, well, yeah, me too. But then again, I do remember from my time doing my internal medicine, even though that's over a quarter century ago now, or working in the prison system, that your ability, a lot of times you're waiting on one or two results to be able to get someone cleared to leave the hospital.
Yeah.
So what it was, I think, let me look, make sure I get the numbers precisely right here. But it was 5.25 days if the lab was not control lab was not retained versus 4.85, so about a half a percentage point difference, maybe it's zero point 0.4, I guess.
Hmm.
Again, might not sound like a lot, but that's actually pretty significant. A, for the patients, they get to go
Hmm.
home. That's number one, right? Number two, that length of stay is definitely a quality metric, which is followed in different kind of systems that look at labs health system quality as a metric for reimbursement, or a metric of patient choice. And then last but not least, there's the cost, right? That's the biggest thing now. Is really interesting at the Executive War College, and I can't remember the name of the act, but there was a guy who gave a great talk about talking through sort of the evolution of healthcare in the United States since World War II. And he pointed out that in that early post-war period, there was a recognition there weren't just enough hospitals in the U.S., and so there was this massive government investment in growing hospitals. The future now is we're actually pivoting back away from having so many beds, because if you have too many beds, then you can't you can't fill them. But if you don't have enough, it has all those carry-on effects, where you can't do surgeries, you can't do elective procedures because you don't have someone to put a bed into. So
Mhm.
it's a huge, that half a day is significant, and it is financially too. Again, it can be hundreds of millions of dollars because of, again, most hospital episodes are reimbursed on a capitated basis, right, with DRGs. So if you stay longer, you just consume more, and it ends up costing more to the hospital. So it's, I think one of the examples we have is about $300 million in savings, just if you compare being able to discharge time with retaining your laboratory versus not.
Yeah, that really is amazing. Half a day difference, and what a difference that can make, especially financially, but also to the patient being able to go home and be with their family.
Exactly. No, it's yeah. I was surprised to see it too, and it brought me back
Hmm.
to those days. And we still see it here, where we have the alerts on the hospitals being full. So being able to get patients in and out, key. And again, it's not just, it's all the other things in healthcare. It's the nursing, right? And the nurses get
Hmm.
to turn over the patients more quickly, and they're less stressed and so there's all sorts of things that does that are improve the quality of a care that a patient is going to get while they're at the hospital.
Yeah, absolutely. Well, the last point in your white paper, I think, is really important, as all of these are. But this one, I think, would make sense, but is maybe not always immediately apparent to the healthcare executives that may be considering a decision to sell the laboratory or not, which is that costs remain after relinquishing control. So even if you relinquish control, someone comes in and buys your outreach program and says they'll run it for you better, faster, cheaper, whatever. But you still have costs that you are going to bear as a healthcare system.
That's right. I mean, you still have to, there are still tests that are so integral to care. You're going to have to provide them. The hospital laboratories are
Hmm.
still going to have to exist, right? And so those costs remain. And the beauty of an outreach program is that it allows you to actually use all those investments you make in having uh, a vibrant hospital laboratory. You use those more fully, right? So you can provide service to more patients and then also help offset the costs. I mean, these pieces of equipment now, as you know, are really expensive, and that's not even taking into consideration what's going to happen in the inflation with tariffs and other things that might happen. So, which is, yeah, another concern. So yes, those costs will stay with you. You will not divest all those costs. The other thing that I've seen, and you probably have seen it too, particularly since you're in clinical microbiology, where there's a lot of point of care options, is oftentimes I know personally where, it probably wasn't incorporated into the study, where the providers, again, if when the lab is sold, turnaround times start to go up, other things start to
Hmm.
happen, right? They don't want to wait. They started going to point of care options for things that could easily be performed in the hospital laboratory. So then you're adding expense there. I mean, it just sort of has all these sorts of carry on, effects. But clearly, you don't just, I mean, you wouldn't want your hospital not have a good laboratory, right? So you're going to have to
Right.
continue to make that investment, but your ability to actually sustain it financially is going to be hampered.
I agree. And I think, speaking as a laboratory director, you have more options if you have some flexibility in how you want to offer tests, because you probably don't want to just buy point of care tests for every single thing. Not everything needs to be done on a stat basis, and that could be more expensive. Sometimes it makes more sense to run a number of tests at one time, and that might be on a different system. So, as a laboratory director, you just have more options when you're looking at the big picture for your community.
Yeah, no, well, no, I true to our own horn here, excuse me, but I mean that's something that you and the Clin Micro division, and the prior leadership as well, has done really thoughtfully. It's like what things need to be at a point of care.
Yep.
How do we design it systematically, right? So the things that need to be point of care are, but the things that are better served within the hospital laboratory, within the central core, or
Hmm.
what would be the equivalent of a hospital laboratory, get performed there. And for me, in my career, if you consider Mayo Clinic Labs as sort of like an Uber outreach in many respects, it is.
Yeah.
A lot of tests that we were able to develop and maintain and make available to patients on our campus, we could only do so because we had the sufficient volumes from the outside to actually help us maintain a very, what I think is the most diverse test menu of any single laboratory, which is over 3,000. So that's to me a
Yeah.
testament of the ability of the outreach and a vibrant laboratory to make investments and to bear the cost of doing those things and maintain the quality. So yeah.
Yeah, your local patients and the community benefits from that
Yeah,
ability.
that's right. And the knowledge, right? Because
Mm-hmm.
you and I have talked a lot about this too, but as laboratorians, our role is not just to produce a result. Our role is to help answer a clinical question with those
Yeah.
results and point them in the right direction. If, we can't do all the testing in our laboratories, but if you're so removed from much of it, it becomes much more challenging to actually enter into that conversation, I think. I don't know, you might
Mm-hmm.
differ.
Oh, no, I agree completely. And there is something to be said by having more testing. You can teach the next generation of laboratorians because tests are being performed locally, and those laboratorians or other healthcare providers will maybe more likely to stay in your community system. If you're sending all of your tests out and you don't have the ability to maintain control over your own laboratory, then you may not have the experience with those types of tests. So it's a balance. Like you said, some things might make sense to send out, some things you might want to do locally, but the knowledge you gain by doing certain tests locally, having access to those patient specimens, maintaining competency for being able to do those tests can be invaluable.
Yeah, totally agree. And so I guess the bottom line is the two things out of this study is it really reinforces the importance of the laboratory in the overall vibrance and sustainability of the healthcare systems that they're in,
Hmm.
number one, right? And number two is to help, you know, decisions made around the laboratory by any health system or healthcare organization are going to have significant impacts. And so just to make sure that whoever those decision makers are fully informed so that they know, I think there must be an appetite for this out there because like I said, it's really getting a lot of traction already, just the messaging, and we're just really getting started. So, and for me, it's gratifying too, because it's a reflection of all my time in DLMP and at
Hmm.
Mayo Clinic and get really feeling like I was taught by the laboratory and taught by our predecessors, taught by our clinicians, and really got a unique, or not unique maybe, but I did certainly have the opportunity to see that value that the labs create for patients and for Mayo
Hmm.
Clinic, and to help share that messaging on the outside is really gratifying.
Yeah, absolutely. I can imagine. Well, we'll make sure to include a link to the white paper so people can read it on their own and take a look at some of those really neat graphs and impressive numbers. And then you're going to be giving a talk on this as well, right?
Yep, well, as of us taping this, it'll probably be out. It's I think later this week. But yeah, it'll be like I mentioned, a webinar hosted by Becker's. So, and we already have several hundred people who said they were going to show up. So
That's wonderful. And I think of this information for both laboratorians and hospital executives.
totally.
Laboratorians can have this information to bring to their own executives to explain the value of having the laboratory, but the executives are the ones that probably need to hear this if they're thinking about maybe selling their laboratory or other options. And so hopefully the executives and the laboratorians can use this white paper to really talk through what this would mean if they were considering not keeping control of their own laboratory.
Yeah, that's right. And the nice thing in the white paper too, there's a button or a spot to know how to contact us. I mean,
Yeah.
that's where Mayo Collaborative Services. So we're here to work together and help. So avail them, please, if people are interested, avail yourself of that opportunity as well.
Yeah, great. Well, thanks for going through that with me, Belle. It was a nice
Yeah,
read, and I learned even more just talking with you over all the numbers and the 5 different findings.
yeah, no, it's great. Thank you for the opportunity.
All right, until next time. See you
Until
later.
next time, see ya.
Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.